It's the voice of Indiana County, WCCS, AM 1160 and 101.1 FM. And our conversation with our folks from the emergency department at the Indiana Regional Medical Center, brought to you by Marcus & Mack, a law firm representing injured people. Dr. Donna Balewick, the medical director of the emergency department, and Norm Fry, RN, the emergency department nurse manager, are both on the line with us this morning. I'm not guessing either one of you wants to intentionally be infected with coronavirus, do you?
I don't think it's a great idea. No, I really don't. I wash my hands for a good reason. I try to avoid lots of germs.
I would guess. Well, good morning to both of you.
Good morning.
It's good to have you both on the air with us today. Wanted to talk about the emergency department through the various stages of the pandemic and, of course, the use of the emergency department now at the Indiana Regional Medical Center. And one of the things, Dr. Balewick, that I was told by someone very early in all of this was that right after the restrictions were announced, somebody had to go and get, I think it was a foot x-ray, I'm not certain, but they said it was amazing to them how quickly in the emergency department IRMC had adapted procedures, and he felt completely comfortable going in there because he knew that the steps were being taken to correctly address this and to keep everybody safe and distance from each other. He said IRMC was doing it right in the emergency department. I'm sure that has to feel very heartening to you.
It is. There was a lot of work and planning that went in very quickly, and we adopted a plan of we're going to screen everybody, limit visitors. If people had any suspicion of illness, they were moved to what we call a negative pressure area with, the ventilation all going outside directly instead of going and spreading throughout the department. We have appropriate personal protective equipment that we have been using, what I think is appropriately. And I think we've done a stellar job, as has the county, for the most part, doing their social isolation and limiting interaction. So we're seeing a lot less of other things in addition to not seeing a lot of COVID, fortunately. I'm not sure what's going to happen as of today when we open things. But we did a good job planning, and hats off to Norm and the rest of the hospital as well for, diving in and getting where we needed to be very quickly.
Norm, you and everybody else working in the emergency department, of course, you had to implement these new procedures right from the start, and there's really no leeway either way. You have to follow them to the letter, don't you?
Correct, yes. You have to wear the protective equipment, not only for the safety of the staff, but the safety of the public also. So to touch on what Dr. Balewick said, and to that individual you related to with the ankle injury, we screen everybody, and we protect not only those people with COVID symptoms to isolate them and get them on the path to get better, we also protect the people without the symptoms to separate them from that population with the respiratory symptoms. So, yeah, we take great pride in definitely using the proper equipment here at the hospital.
Right before all of this happened, I had to be in the emergency department with a family member, and if I were to go there today under that same circumstance, would it be substantially different, the experience of going to the emergency department, than it was then?
I think there's things that we are doing differently. There's visitor restrictions. A parent can come in with a child, a person that has a disability that needs an assistant. They can have them. If somebody has very severe hearing loss or they have dementia, we let a family member in under certain circumstances. But the open visitation and the doors with an influx of patients in and out and visiting no longer happens, and the waiting room is essentially empty. You would see different kinds of registration. If you come in with respiratory symptoms, the registration person is going to have you call them by phone, and we do registration by phone as opposed to exposing another person in the room, to you if you potentially have a viral illness, respiratory that may be COVID. The rest of our procedures are the same. I mean, it's the same excellent care every day. If you present with, any complaint, we're going to treat it. We're not treating things differently. We're not treating ankle injuries less, seriously. We're not treating heart attacks less aggressively. We're providing the same care, but with due caution to not expose family members, staff, and other patients to things that may be, in the department.
We had some stories that came from other cities. For instance, one I cited to Dr. Clark last week of a woman in Washington State who had experienced some severe headaches, and it turned out she had brain bleed. She delayed going to the emergency department because she didn't feel safe, and because of it, it made the situation much more serious, and she died from it. They just couldn't save her. I guess what you would say to folks, and I don't want to put words in your mouth, is it's entirely safe to get to IRMC and necessary for whatever your emergency might be.
Absolutely. One of the things that we've seen is our volume has dropped off. It was quite significant for a period of time. And the answer is, the question would be, where did the strokes go? Where did the, appendicitis go? Where did the heart attacks go? And the answer is they didn't go away. People just came in later, sometimes to the detriment of their health. So we want people to know that, we're still open, and we get calls every single day, are you open? And the answer is yes. We are open 24 hours a day, 7 days a week, and we're fully staffed, and we're here for everybody, but we don't want people to wait worrying about potentially an exposure. We're handling that part on our end. We're handling protecting you from, unnecessary infections, but we are here also to take care of your emergencies every day, all night.
Norm Fry, with your nurses and you being a nurse, as this has unfolded, and your nurses have stepped into the front here, and they've been doing the job, and more than just doing the job adequately, but just heroically, has to make you proud, but it also has to make you pretty impressed by the skill level and the adaptability of the whole staff.
Absolutely. I can't say enough about the staff, how from day one, initiating everything, rolling out with everything, they have just been exceptional. We follow the CDC guidelines, we follow the protective, and they've just hit it out of the park. I can't say enough.
So that being the case, what are some of the, I guess not what are some of the things that they're doing differently, but how are people going to notice what they're doing differently, or will they?
I think part of what you see is, the masking, and we're getting used to looking at each other with masks. And I think that, you see people that look like they're wearing spacesuits at times, and they can be very frightening. But when patients understand why we're wearing them, and we try to inform them as to why we're wearing masks and goggles in the room, why we're changing, the way we look, I think patients actually get it, and they feel safe by it. We have different accommodations. If somebody has, difficulty communicating because they can't, they normally would read lips more than you'd assume, and all of a sudden we can't see each other's lips. We actually have a plexiglass screen on wheels that we can roll into a room and, for a moment pull down our mask so that the patient can see us, and then we can, our communication is better. Mm-hmm. So we have adaptive behaviors as well for how to take care of the patient in the moment.
Do patients get masked as well when they come in?
Yes, they do.
Okay. One of the things that another patient at the emergency department told me as well, they had to go upstairs for a test, and they were impressed by how security gave them the vanguard and made the pathway in front of them clear, and just made sure that there were no possibilities of anybody coming upon anybody else who might be at risk. And that was a very impressive thing for them as well.
Yes, we have a dedicated elevator that's not used by the staff or the public if we have to transport patients, to the floor. And we announce it overhead where the patient's going from, where they're going to, and so that path is cleared.
So the message that you want to get out today to folks is they can feel perfectly safe and perfectly comfortable that when they get to the Indiana Regional Medical Center, they're in the safest possible environment, correct?
Yes.
Yes.
Absolutely. All right. So, and we want to make sure that we reiterate that with people. So if you have an emergency and you need to use the emergency department, that's terrific, and that will be available to you. And Urgicare is something we haven't addressed because you're both in the emergency department, not Urgicare. But Urgicare has its own procedures too, does it not?
Yes, and they're open as well. One of the things, the federal guidelines that has been relaxed during this time is initially when patients would present to the emergency department, they had to be seen in the emergency department. They couldn't come and ask for directions to the urgent care, for example. But now we have centralized screening, so we're screening all patients for, temperature history and offering them the opportunity to go to the emergency department or urgent care. So we have that centralized screening at IRMC. Chestnut Ridge has their own set of, screening guidelines.
Dr. Donna Balewick, the medical director of the emergency department. Norm Fry, the nurse manager in the emergency department. Thanks so much for spending some time with us today. It's been educational.
Hey, thanks.
Thank you.
My pleasure. Have a great day today.
Stay safe. Have a great day.
6 away from 9 o'clock. It's the voice of Indiana County, WCCS AM 1160.